Good afternoon. This is Dr. A with Pro Health Services, and I'm a physician who specializes in enhancing your health and wellness through medical weight loss, hormone balancing, body sculpting, and addiction medicine to improve your quality of life. First of all, I'd like to welcome you and thank you so much for joining me. And if you're here live right now, please type hi in the comments and hello and welcome. And I'm excited to see you. Also, if you are watching the replay, I would love to know that you stopped by to visit us. So please type replay in the comments. In addition, if you have any questions, please feel free to post them in the comments and I will do the best of my ability to answer them. I see a lot of guys who come in with a variety of symptoms as they age, such as fatigue, irritability, decreased muscle mass, decreased concentration, weight gain, and often sexual dysfunction. And they often ask what can be done for their symptoms. And it usually starts by someone asking bashfully about the little blue pill to try to fix one problem, but there's often more than what meets the eye. And ignoring these symptoms can do more than just affect their function, it can also cause a very significant decline in their quality of life. So, I'm sure you know other people who ask the same kinds of questions. So go ahead and please share this video with them. And if you want one-on-one attention to address either your weight or hormones, please visit prohealthservices.org and schedule an appointment. So, my topic today is to discuss testosterone in men. And I've discussed hormones before in women, and today I wanted to focus on men because testosterone is the main male hormone and it often decreases as men get older. And then they get symptoms. And so, symptoms of low testosterone or andropause, as we often call it as men get older, include fatigue, depression, osteoporosis, insomnia, decreased libido, decreased muscle mass, erectile dysfunction, decreased memory, irritability, heart disease, and decreased cognitive function. And men seek evaluation and they're often told, oh, this is just part of aging. This is part of getting older. But I don't think too many men really like that. They'd rather not deal with some of the symptoms. In addition, these men may get some labs drawn and they're told that their labs are normal. But it's very important to understand that there is a difference between normal and optimal. Most labs would tell you you're normal if your range is somewhere between 300 and 1,000. But between 300 and 1,000 is a big range, and people with a level of around 1,000 feel a whole lot better than people with levels around 300. So, as the testosterone level decreases in men, it actually is associated with other health complications that we really want to try to avoid. For instance, a testosterone level less than 900 is associated with Alzheimer's disease. Go figure, it drops and you might have Alzheimer's disease. A testosterone level less than 840 is associated with aggressive prostate cancer. A testosterone level less than 770 is associated with metabolic syndrome, such as type 2 diabetes, high blood pressure, and high cholesterol. And a lot of times when people have metabolic syndrome, it often goes hand in hand with obesity. A testosterone less than 600 in itself is associated with an increased death rate. A testosterone level less than 450 is associated with type 2 diabetes. A testosterone less than 432 is associated with fatigue and decreased libido. So when guys don't feel very well, maybe it's because the levels are dropping. A testosterone less than 332 is associated with coronary heart disease. Testosterone less than 282 is associated with depression. And by the time you drop less than 231, that's associated with erectile dysfunction or parts not working. So again, there's a big range of symptoms and conditions that men can be suffering from, really related to their testosterone level, whether it's normal or optimal. So, for instance, when I see men who come in with obesity or metabolic syndrome, I always inquire about their testosterone level because, again, we see that with the lowering, that's often associated with type 2 diabetes or metabolic syndrome. So the good news, though, is that there is safe and effective treatment for low or suboptimal testosterone level. And to summarize, testosterone is the main male hormone, and there's a lot of symptoms associated with low testosterone that men will complain about, or they may not complain about. Sometimes they're bashful and keep it to themselves, but they're left suffering or thinking that this is just a normal part of aging. And while it is a part of aging, do you want to age that way, or do you want to improve your quality of life and age in a much healthier way? Men will often get their labs drawn. They're often told they're normal, but there's a difference between normal and optimal. And again, we see that there's a lot of symptoms or a lot of associations when the testosterone level starts to drop. So again, there's good news that's safe and effective, and that we here at Pro Health Services love to partner with patients to try to find a safe, effective treatment plan for them and to help them get some relief. So if this information was helpful, or if you learned something new, please type helpful in the comments. And again, please be sure to share this video, because there are so many men who are suffering who just don't know where to turn for help. So imagine for a moment, if you will, if we worked together, and how much better you would feel if you had either an easier time losing weight because your hormones were optimized, or if you had more energy, or if you had improved memory or improved cognition, or possibly improved libido or function. I would love to help you get there. And so again, please visit us at prohealthservices.org, and or click on the link in the comments to get to our website. You can schedule a consult. We offer telemedicine, or give us a call at 614-442-2600. Thank you so much for joining me this Thursday afternoon, and I'll be back next Thursday at 12:30 p.m. Eastern Standard Time. Bye for now.